Hey everybody, happy Monday. We're coming off our July 4th weekend. Hopefully everybody had a wonderful time celebrating. I know how Mondays coming off of a holiday weekend can be, so hopefully I'm lighting up your lunch hour a little bit with a little Learn with Flo. So grab your lunch and let's dive into today's topic, where we're going to be continuing our foundational lab interpretation series into this world of micronutrients, right? So if you've been following along with this series, really my big kind of why and passion behind launching this series was to help individuals feel more empowered and educated on how to take something like a foundational lab work, something you might get from a traditional practitioner, a conventional practitioner, something you can request from a doctor, something that I run as part of my functional wellness consult with every client. So if you don't have access to comprehensive lab work the way that you wish you did, you can always sign up for a functional wellness consult through myself as well too. So my passion kind of came from making sure that individuals can take some of these labs and not just feel like tied to the interpretation of like, oh, your labs look normal, come back next year. I can't tell you how many times I've seen individuals with that kind of takeaway, especially because I know that for a lot of individuals, it takes quite a bit for us to even seek out some help or a second opinion on our health in the first place. And so a lot of times by the time we get lab work and all of these things, like we're excited about the opportunity to get some answers and to get some validation behind the symptoms that we're experiencing, and it can feel very dismissive and discouraging to get comprehensive labs and then be told, well, everything looks great, or, oh, it must be all in your head, or you just need to lose some weight, right? And it's like, those are such unhelpful and disempowering type of conversations that happen way too frequently in more of a traditional healthcare setting, because they're just not equipped in that setting to be thinking about like this continuum in the middle of individuals, right? And what I mean by that is there's a graphic that I share quite frequently, and it's called the sickness to wellness continuum. And we think about like literally like a half moon dial, right? And really what we're faced with today is we have this whole population of individuals that are diagnostically sick, right? And we're talking like I said, like big diagnoses, right? It's like, oh my gosh, we have diabetes, we have blood pressure issues, we have metabolic syndrome, we have high cholesterol, and all of these issues. Like we have these diagnostically like sick individuals, and then we have all the way over to like optimal health, right? And then we have in the center like wellness, right? I guess I should say all the way on this opposite end is technically like fitness, right? We take like all the way to your like elite athlete and operating at a very high level performance human, right? Then you have the middle, and it's called wellness, right? And what happens is like the conventional situation kind of gets stuck between this like sick and well continuum. They're like, well, if you're not sick, I can't help you. Right? That's really kind of what you get, which is why they provide you the information of like, oh, your labs are all normal, just come back next year, right? Because you feel crummy, but your labs aren't sick enough yet for them to be able to help you, right? So then you kind of get stuck in this like, well, I surely don't feel great, and I'm definitely not as fit as I want to be. So I kind of feel like I get lost in this sauce somewhere of like, so I just like, I feel like garbage, but I have to just continue to wait until like I feel bad enough to be able to be helped by more of a conventional standpoint. And that's really where like more of your holistic and your functional care start to take over, because we start to catch these things early, right? Dare I say, be like preventative about our health and care, so that we don't end up on the sickness end of the continuum, and we can live our life really more flirting with this like wellness to fitness continuum. It's like, I want to take you not to sick, but to well, and then well to like living your fittest, most resilient life, right? So that's where you sometimes get a little bit of that nuance of individuals that are like bringing in labs, and I'm like, yeah, your labs aren't maybe on the sickness continuum, but I start to see some things where we can start to create some interventions like now. So that's really where I wanted to come out with this series, so that you guys could start to get a little bit of a behind the scenes sneak peek of how I'm looking at labs and how I like to interpret blood work, so that you can go back to some of these labs that you've maybe had drawn and you're like, oh yeah, they said that there was nothing suspect about my thyroid levels, but now that I listen to Lauryn's thyroid interpretation, actually there is, right? And so there might be some diagnostic things that we're kind of catching a little bit earlier and creating a more proactive intervention strategy, right? So if you've been following along with this series, we did a full breakdown on a thyroid panel. What should you be asking for? What is the definition of a complete thyroid panel? It's not just TSH or T4. And how do we interpret those? We also did the same breakdown for like a total cholesterol panel or a lipid panel, as well as blood sugar markers last week, which then brings us to a conversation around micronutrient panels today. So again, like I've said multiple times with this series, I'm very, very passionate. I don't feel like you need a PhD to feel empowered about how your body works. So I want you guys to be able to see, like, okay, when I draw a functional wellness lab for a patient, what are the things that we're talking about? How are we interpreting some of these to be able to identify where problem areas are creeping up a little bit earlier? And also, more often than not, as we start to connect the dots, their symptoms become so much more validated. They're like, oh, so is that why I'm crazy fatigued? Is that why I'm not sleeping through the night? Is that why I'm noticing my hair thinning or falling out? Is that why I'm noticing crazy amounts of anxiety, or I'm noticing certain cravings, or I'm noticing bloating and inconsistent bowel changes? I'm like, yes, yes, and yes, right? So we're able to really kind of bring things full circle and start to look at it from a root cause perspective. So rest assured that even as we start talking about like lab works and all of this type of thing, like I want you to feel empowered looking at your labs and asking more, what I want to say, like, educated, I guess is the word that comes to mind, more educated questions about some of the lab panels that you're seeing as well too. So if you missed any of our four other, or any of the three other parts of this series, feel free after this to go back and take a listen to those, because they do all kind of work synergistically together as you may be digging into some labs that you've had recently or labs that you've had in the past too, and kind of compare and contrast between how I'm interpreting them versus how you might hear it from a conventional medicine standpoint. So let's dive into micronutrients, or what some people might call nutrient deficiencies on a functional lab panel. So micronutrients, let's just level set on some terms here, is a word that we use to describe essential vitamins and minerals, right? So we think about all the different things that our body gets through food and sunshine and nature and all of these things, but our body is going to extract things like protein. It could extract things like fiber from our food. It can extract things like fats from our food. It can also extract these categories called vitamins and minerals. The reason why these are so important is because these are things that we cannot create in the human body. We must get them through our food, specifically minerals. We cannot get those from we can't make them from our body's internal resources. We have to get them through food. So let's just walk through some examples so that we're all on the same page. When I talk about vitamins, we think about like fat soluble vitamins, vitamin A, vitamin D, vitamin E, vitamin K. We talk about water soluble vitamins like vitamin C, B2, B6, B12, right? So we have all these vitamins, some of which our body stores for later, fat soluble, some of which our body excretes on a daily basis, water soluble. Then we have the family of minerals. A lot of times vitamins and minerals get lumped together, which is totally fine, but minerals are very different than vitamins. So examples of minerals are going to be things like iron, zinc, copper, potassium, sodium, magnesium, selenium, right? Chromium. I mean, you could go on and on. There's so many different minerals out there, right? So our bodies cannot make these. They have to be consumed through our diet. What do vitamins and minerals do for us? Lots of different things. So we'll keep this like very high level biochemistry, but I think it will start to connect the dots for some of you guys on the role of vitamins and minerals in our body. Number one, energy production. We call minerals the spark plugs of our cells for a reason. We would be unable to tap energy, cellular energy in the form of ATP, right? Takes you back to your biochemistry days. But we would not be able to harness cellular energy from food without vitamins and minerals. So when we think about individuals that are experiencing fatigue, exhaustion, energy crashes, I'm like, vitamins and minerals, like we have to make sure that we have at least a bead on understanding their nutrient status. Vitamins and minerals are also important for building and repair processes, especially things like bones, enzymes, hormones, neurotransmitters. So talk about like mood, anxiety, irritability. All of those things are going to be controlled by neurotransmitters, which are also under the influence of vitamins and minerals. Also things like DNA synthesis and repair. So they're definitely studied for like cell growth, cancers. We also think about cell signaling and communication, and also vitamins and minerals are important for maintaining what we call cellular homeostasis, or really regulating like the water balance inside and outside the cells, which also control things like nerve impulses and muscular contractions, right? So we think about individuals that have like chronic twitches, right? You've always heard like, oh, my eye is twitching, I need more potassium. Oh, yep. If you've heard that before, you've heard the correlation between vitamins and minerals and certain symptoms, right? So this is what I'm talking about when I talk like vitamins and minerals and how we're going to see these kind of show up in everyday life. So when it comes down to micronutrients, as we start to look at these from a lab perspective, just know that the body does keep a very tight control over the circulating levels of vitamins and minerals in the blood. I say that because sometimes it's not as easy as just drawing a lab panel. It's like, oh, let's draw my calcium levels, and you're going to be able to immediately see your calcium status based off of a blood screen. It really doesn't work that way. The body is way too smart for that. A lot of our vitamins and especially our minerals are actually stored in different tissues of our body. So sometimes individuals that I'm really curious about their mineral status, I'll actually run like, it's called a hair tissue test. And you actually submit a small sample of hair because a lot of times hair, skin, nails, that's going to hold a lot more information around like vitamin and mineral status because the body keeps these things stored. So fun facts. I just share that with you because there's lots of nuances in being able to determine what nutrient we need. And it kind of goes beyond just dietary intake, which we'll talk about today. And it's important to recognize that the body functions as a whole. So a lot of times you do need to have kind of like a skilled practitioner that understands how to look at ratios and relationships, as well as correlate these two symptoms and health history as well too, to determine kind of the full picture. So when I think about some of the symptoms of someone that might be struggling with nutrient deficiencies, what would even cause me to look at nutrient deficiencies for somebody? I would say some of the main symptoms that I'm definitely going for: numbness or tingling in limbs, brain fog, poor vision, dry skin, bleeding gums, slow wound healing, fatigue, muscle weakness, mood changes or mood shifts, hair thinning or hair loss for sure, constipation, cold hands and feet, nausea, low appetite. Any of those types of things make me kind of think like, what's our nutrient deficiencies? What's our nutrient status look like? And I will say, spoiler alert, you could be taking a daily multivitamin, you can be eating clean, and I still see individuals walking around with very significant nutrient deficiencies. And that's just because like our standard healthcare system doesn't really identify these, and it's kind of like usually a dangerous kind of waiting game, and things have to get like really bad before people will intervene. And then sometimes we don't always intervene the right way because our understanding of micronutrients is actually relatively limiting, right? So that's where, like I said, just like everything else I've been discussing, more of the functional medicine approach is going to feel very different than the conversations you might get from a conventional medicine approach, because I'm not going to just wait until nutrient deficiencies are so broad that and so severe, I guess I should say, that they're causing like so many downstream symptoms before I'm going to intervene with treatment on these, right? So early detection, personalized interventions, and really kind of looking at more of a holistic approach are going to be super, super key here, so that we're not just needing these like aggressive interventions in the future. Let's put it this way. I'm not going to wait for someone's iron status to get so bad that they need to be on iron infusions before we do something about it, right? It's like that to me is like we should have caught these a long time ago. And there were probably some signs that we missed, right? So let's just take a high level walkthrough. When I'm running a comprehensive metabolic panel on someone, what are some of the micronutrients that I'm testing for? What are some of the reference ranges that I'm looking for? And how could we maybe know that these might be part of the issue or the picture? And then we're going to wrap up our conversation with how do we fix it? How do we solve it, right? So first stop on our kind of vitamin and mineral train, and I will forewarn you, this is not by any means like a full and complete micronutrient panel. This is like standard blood work that you might get from a traditional practitioner or standard blood work that I would run. So if you don't see any of these on your lab panel, don't be surprised. But because, like I said, some practitioners don't run it because they don't know what they're looking for, right? No one would include something on a lab if they don't know how to interpret it. So number one, things that I'm going to be looking for as part of like a comprehensive metabolic panel are going to be simple minerals like sodium and potassium. I definitely want to see sodium levels in the 140s, not lower than that. I'd love to see potassium levels 4 to 4.5 ideally. When these mineral levels are low, and that's very common, I'll see individuals that come in and their sodium's in the 130s or their potassium is like less than 4. I'm thinking, okay, what's their dietary pattern? Are they following a ketogenic diet? Are they dehydrated? Also, this can be telltale signs of poor adrenal health. This individual is probably losing minerals like crazy. There's probably poor adrenal health, or there's poor mitochondrial health and a lot of stress on detoxification pathways, right? So it's starting to kind of connect the dots for me. I'm not sitting here looking at low sodium and potassium and just automatically putting someone on an electrolyte supplement. That would be dumb, right? It's like, yes, of course we can add more minerals to the picture, but I also need to ask the question, well, why? Why are you deficient in minerals? What is draining your minerals? Because otherwise we're operating off of a bucket with a giant hole in the bottom. And here is someone that's like, well, I take electrolytes every single day. I'm like, well, that's great. You're putting water in the bucket, but you're draining water out of the bottom of the bucket just as fast as you're putting it in. So like, we need to figure out like why you're draining minerals so fast. So a lot of individuals that say like they drink a ton of water and they pee like every hour on the hour, or they pee and their pee is clear. Your pee should actually not be clear. That could be a loss of minerals, right? So we don't want to just think water, we want to think hydration. And hydration means we need to be replenishing minerals as well as water, and be looking at where we might be draining minerals as well too. So low sodium, low potassium definitely make me think like what's going on with the adrenals, right? Second place that we kind of pit stop here is magnesium is another common mineral that will be tested. I prefer to test what's called RBC magnesium, or red blood cell magnesium. It's much more accurate than just drawing a general magnesium in the plasma itself. Like I said, it's very rare that you're going to see a true magnesium picture by just drawing magnesium in the blood. So making sure it's called RBC magnesium is what you want to draw. Optimally, that should be greater than 6. A lot of times I'll see this associated with headaches, cramping, twitches, someone with restless leg syndrome, someone that has a lot of teeth grinding going on. Another marker for magnesium is one of the liver enzymes that we can run called alkaline phosphatase. If your alkaline phosphatase is less than 50, it makes me think like zinc or magnesium deficiencies, right? So again, this is me explaining to you like how I look at like the person's full picture to identify micronutrient deficiencies, not just looking at like one thing. Vitamin D status, definitely a great one to run. Optimally, I like to see someone's vitamin D between 50 and 80. More is not always better. So if your vitamin D traditionally runs above 80, that's actually a higher risk of things like kidney stones. So beware of that. In terms of like excess supplementation of vitamin D can actually drain you of other minerals like zinc. So that's why I think there's just a world out there, a crazy world of like supplementation, and people aren't quite understanding like what's the root cause. If you have low vitamin D, being that it's a fat soluble vitamin, we probably need to be looking at how we're digesting and absorbing fats. We need to look at bile. We need to look at gallbladder. We need to look at liver. Like, I'm not just putting someone on more vitamin D. like that's probably not going to fix their issue. If they're low vitamin D, they're low vitamin D for a reason, right? Why is that reason? So we need to look a little bit bigger there, which we'll talk about in a second when we talk about like fixes. B vitamin status. A lot of times you'll see practitioners run like a B12. That's totally fine. I would say the best markers though for B status are going to be things like in your like complete blood count. I'm always looking for like low or high ranges in like red blood cells or things called MCH, MCV, RDW. Those are just looking at the size and the shape of your red blood cells. All of those can be indicators of low B6, B12, B9, or like your folate status, right? So a lot of times I'm looking at like your red blood cell panel to look at things like overall B vitamin status. I'm also drawing something called like homocysteine. Homocysteine optimally is going to be less than 8. Otherwise, that tells us that you have poor ability to methylate and properly use your B vitamins as well too. So again, someone could just run like, B12, that's great. That can be really helpful information, but we can also see other areas where your B vitamin status can show up as well too. Iron status. This is kind of the last one that we tend to look at very commonly. There are multiple markers that we can look at iron status. Iron is incredibly complicated because the body sees it as something that actually needs to be like sequestered away. So there's not usually just a whole lot of free floating iron in the system, because you think about iron, it rusts and it oxidizes, right? So the body doesn't want to just keep that out in the system willy-nilly. So we look at like optimal iron levels between 40 and 100, optimal hemoglobin, 13 to 15, optimal ferritin levels. Ferritin is something that's getting a little bit more time in the sunshine. Menstruating females anywhere from 80 to 100. Males will be more like 60 to 100, right? If there's high ferritin, then we start to think about just like inflammation and infection altogether, right? So there's lots of different ways that we can take these labs and kind of look at B vitamin status, nutrient status, mineral status, right? Which I think are so important as part of the picture. But then if individuals are deficient or maybe even like toxic or too much of some of these vitamins and minerals, I think it's a little bit too simple-minded to think that we're just going to bring in supplemental support here. I think it can come from both a combination of dietary and supplemental support, but when I'm looking at these nutrient deficiencies, how do I help individuals go about fixing them, right? So if you're kind of, like I said, hearing this and you're like, wow, I think I definitely have some micronutrient deficiencies according to my latest lab work, or I think I might have some micronutrient deficiencies, how would I go about correcting these? Number one, I'm definitely starting food forward, right? We're going to start with nutrient intake first. We need to think about more of like the density, the nutrient density of the foods that we're choosing and the variety of the foods that we're choosing. So that's something that, like I said, I get into more and more in my one-on-one consulting work with individuals, or if you're curious about the food forward way to correct these, I would absolutely direct you to my Master Your Metabolism Masterclass. That is going to be my 6-week course on balancing blood sugar, increasing nutrient density, increasing diet variety, sourcing your food from reputable places. So that like Master Your Metabolism Masterclass is all things functional nutrition and gives you a really, really solid foundation. So you can start that at any time. I would encourage you to go to the link in my profile and you can find my Master Your Metabolism Masterclass there. So that's where my first stop would be. Then we start to think about other things that we get some of these nutrients from, like nature exposure, right? A lack of nature or a deficiency in nature is a very real thing, right? We think about sunshine exposure, we think about soil exposure. That's where we get access to minerals, right? It's like you pull a carrot out of the ground, it's got dirt on it, like that's minerals, right? So we think about like not getting connected to nature quite as much can also be part of our nutrient deficiency equation. Outside of like taking in more nutrients, we then start to think about like lifestyle reasons, right? Not just like taking in nutrients, but what about this hole at the bottom? Where might someone be draining an intense amount of micronutrients and why they're not able to keep up with their body's overall energy demand? This is usually where I get into like next tier cases where individuals maybe have gone through my Master Your Metabolism Masterclass. They've made some very significant dietary changes. They're eating a nutrient dense diet in a blood sugar balanced way. Now that next level is like, and I'm still dealing with these symptoms and I'm still dealing with some nutrient deficiencies, now I start to think about, okay, lifestyle wise, what are some situations where people need more minerals or vitamins than the average person? Or what are situations where people are losing minerals and vitamins very, very rapidly from their body? Their body is burning through them like crazy. So things that we think about for sure: high stress life, very high levels of physical activity, high amounts of like heat exposure, like saunas or outdoor work, someone that has poor sleeping patterns, high alcohol intake, medication use, like, or even just thinking of like certain situations that are depleting, like breastfeeding for mothers, right? So there could be certain situations where the adrenals or the body itself is very taxed and is requiring a lot of vitamins and minerals, and our intake is just not keeping up. There's also situations where we think about like digestion and absorption. So we start to think about the gut, right? Very often, especially with some of those like fat soluble vitamins like vitamin A, D, E, and K, or if we're talking about like iron status, absolutely do not pass go, do not collect $200. We have to look at digestion and absorption here. There's more than likely an issue with bile, gallbladder function, liver burden, or there's some issues with stomach acid and or like intrinsic factor, which is another part of stomach acid that's created in the stomach lining or the parietal cells, right? So usually, like I said, these are signs, guys, right? It's like low vitamin D, but I supplement with 10,000 units of vitamin D every day, and my like I'm still not in those reference ranges. I'm like, very interesting. I don't think it's taking more vitamin D. I'm like, stop. I'm like, we need to look, like this is a sign and a symptom of bigger gut issues. Same thing with iron status. I see so frequently where I'll see young women in here and they're like, oh, I was told I was anemic or iron deficient, so my doctor put me on iron. I'm like, and let me guess, now you're constipated. And they're like, yeah. I'm like, really constipated? I'm like, that's because iron is incredibly constipating. And I'm like, did you feel any better on the iron? They're like, no. I'm like, yeah. So we just created another problem. The problem isn't like you don't just need more iron. The problem is recognizing like we are in a world that is fortified with iron to the gills. Like, why would your body be low in iron? Very interesting. So that's where more of an advanced workup, usually it goes back to, again, digestion and absorption. Hindrances there with problems with stomach acid, bile, or liver. There could also be some gut overgrowths that really contribute to iron dysregulation as well too. Specifically, things like parasites can eat iron and cause someone to become chronically iron deficient. So I'm not just putting someone on iron or putting someone on vitamin D or putting them on more B vitamins or putting them with more electrolytes. It's like, it's a more comprehensive story than that. I'm not saying that those supplemental things can't be helpful, but they're definitely not the full story, and they're just a Band-Aid solution for us actually like distracting from the real root cause issue, because a lot of times these micronutrient deficiencies, they're just a symptom. They're a symptom of like the body trying to tell us like, wow, my adrenals are really tired, or my liver is really burdened, or I'm not digesting and absorbing food super well. And it's like the body needs more nutrition, but the body also needs to cap the hole at the bottom of the bucket. So when I kind of think about that, know that, like I said, lots of different functional providers will use different routes with patients. And I think all tools are valid tools. I think supplements, I think nutrition, I think gut work. But really it's more about putting all the pieces of the puzzle together so that you're not just accidentally walking out with like, oh, I'm supposed to take a B12 supplement, I'm supposed to take an iron supplement, I'm supposed to take a vitamin D supplement. I'm like, yeah, but why? I'm like, all of these fit together, right? You're not just deficient in all of these micronutrients for no good reason. Like, this is the body trying to communicate something with you, right? So making sure that we take the time to kind of zoom out, pull back, view the body as a whole, and start to use that kind of as our investigative puzzle to help people really find their healing success story. So that's what I am. That's what I do here at the Lowdown. So if you're interested in a lab panel of your own, or kind of, like I said, a more functional eye and interpretation on lab panels, feel free to sign up for my functional wellness consult. You can, again, click the link in my lab or click the link in my bio and see the link to be able to register for a functional wellness consult together, where I can order some labs and interpret that for you as well too. So, So I'm really excited, like I said, to continue a lot of these conversations. Yes, Janelle comes in with an awesome comment. This is also fascinating. I suffer from Hashimoto's and hypothyroidism, and there's so much to learn. I'm on my journey to feel better. Yes, Janelle, sending all of the good healing vibes your way. I'm a huge educator and advocate of really learning how that autoimmune disease process, kind of, where does it come from? Where is it kind of contributing to some of those, like I said, leaky gut, stress, adrenal type patterns, and that can definitely be a part of where those micronutrient deficiencies come in as well too. So much information to learn, and if I can be, like I said, a resource for any of that, I'm happy to help on your guys' journey. Otherwise, stay posted. I'll be back next Monday for another episode of Learn with Lo and our functional lab series. Happy Monday.